So the majority of the medical ethics questions you can get asked will either focus on an ethical opinion, where you're being asked what you think about whether euthanasia should be legal or abortion or another ethical topic. And another situation is an ethical scenario, where you get given a simulation of some sort of ethical scenario at a clinical setting, and you're asked what you would do in that setting. For ones where you have a difficult colleague or someone who isn't behaving quite as they should, there's a very good acronym which stands SPIES, S-P-I-E-S. S is for seek information. So you're looking to get as much information about this situation as possible. P is patient safety, which is always priority number one. If there's a situation with a difficult colleague and there is patient safety at risk, then you need to do what you can to minimize risk to patients. I is to take the initiative, and that means to do whatever it is you can to try and resolve the issue yourself. And E is to escalate. So once you've done everything that you can then escalate to your seniors and let them know about your concerns. And then S is to have support. So you're looking for support of the colleague who isn't behaving appropriately. So let's say we've got a situation where you are the junior doctor on a ward and your consultant shows up to work drunk. Very classic situation. So what they're trying to do here is to see how you would handle this ethical scenario. So going through the SPIES structure that we mentioned. So S is to firstly seek information. So all you've been told is that the consultant is drunk. You want to know a bit more information. So you're looking to gather information such as what makes you think that? Why do you have that opinion? Is it their behavior? Is it their smell? Did they literally tell someone? So you want to gather as much information as you can about the situation to make sure that you have the right assessment. And then next is patient safety. So if this consultant is looking after patients and they're responsible for their healthcare and they are likely to cause patient harm, then that needs to be acted on immediately. Whether that is pulling the consultant over to the side and saying, we have these concerns, you pull them over to a quiet place and don't do it in a public space to try and make things as professional as possible and to try and make the process go smoothly. Just to clarify, you want to make sure that the patient safety has been clarified. So you're looking to assess whether this situation is compromising patient safety. And if it is, then to do what you can to resolve it, which is the next step. So I, initiative. So for you as a junior doctor to challenge the consultant and take disciplinary actions is a bit beyond your scope. But what you can do is you can take them aside yourself and have a discussion with them privately. You can arrange for a taxi for them to get home to make sure that they get home safely. So all of those things are within your realm of control. E is to escalate. So once you've done everything that you can yourself and you've gathered the information, you've made sure that patient safety is prioritized, you've taken whatever initiatives you can, you then escalate. You normally have a supervisor or a senior who you can escalate your concerns to, and you want to keep the number of people that you escalate to at a minimum. You don't want to go and tell as many different people as you can to minimize the gossip and minimize the idea that you're spreading this information, which is relatively sensitive unnecessarily. You want to escalate to your senior. S is to make sure that that person is supported, making sure that they're getting enough emotional support, that they are getting whatever it is that they need from the workplace to help them through whatever difficulty they're experiencing, which has led to this behavior profile.